Sure. Well, good morning, Dr. Seshmi, and welcome to the show. Sorry about it's 1 minute past 7. We should have been on earlier than that. But I was trying to get on some Facebook, and the thing is it's going so slowly. We're getting there. So I thought let's just start, and then when we get hooked on Facebook, I will let you know. I will announce it so that you can go to Facebook and watch us if you want to. How are you this morning, my sister from another mother?
Good morning, Opoku, and thank you so much. Always a pleasure to be on the show. I'm doing well,
Thanks.
much better. Thank you so much. I just
Yeah,
needed a bit of rest, and also, I had like a headache and just a slight cough. It wasn't COVID, but I was on call the week before, so I just wanted to take precautions. But I'm feeling a lot
yeah.
better.
It's. I think you work too hard, Doctor Session. You work very
No.
hard. You're always on the move, man. So yeah, you need the rest, man.
Yeah.
You do need the rest. Yeah.
Yes.
And that is why when you apologize for not coming on the show, I think no, you shouldn't apologize. I mean, you're a human being and you work very hard, so you will get tired at some point, won't you?
Yeah.
Uh,
Anyway, I'm
anyway,
back to
we
normal, all better, and yeah, I think it's just when I had these like the headache and the cough, you do start to
yeah.
think whether you've got COVID or not.
Hmm.
Luckily, I didn't have any other symptoms, and it was just like for a day. But it was just because I worked as well in the hospital. I was on call the week before, the whole week, so I just was, just taking extra precautions. And I think it must be like that for so many people. Imagine if I'm feeling like that,
Yeah.
working on the front line, having to go to work. And even people not working on the front line, just working in shops, working in supermarkets, people like the
Yeah.
police and the ambulance. It could be anyone because you can actually pick the virus up anywhere. So,
Well, you can pick it up anywhere, Dr. Session.
exactly. So,
You can
you
pick it
know,
up
the
anywhere.
Exactly. So it just gave me a bit of like how other people were feeling as well, because I hadn't
Mm,
felt like this at all during the pandemic. So it's the first time.
yeah.
But yeah, luckily it was not related. I knew it wasn't related, but I just wanted to take extra precautions. So yeah, if anyone's listening and also has any symptoms, just make sure you get yourself checked out and
Yeah.
you have some rest.
I can imagine how you're feeling. For example, my wife has to test twice
Yeah,
every week because obviously of what she does, and she's a proper frontliner.
yeah,
And when she does the test, I'm always like, keep my fingers crossed. I'm thinking, oh my
yes,
God. Uh, Fortunately, and thankfully, it's always come out negative. So that, yeah, that's a good thing.
yes.
That's a good thing.
That's
Session
good.
with Yeah, I woke up this morning to the news that the UK has got a fourth vaccine, the Novavax vaccine,
Yes,
which is showing 89% efficacy in the
yes.
trials, and also it's talking about the fact that this one will fight or will it's effective in large scale. It's effective against the UK variant.
Yes, yes, I
Yeah.
did read that as well. So they said that the MHRA, the Medicines and Regulatory Control, will be
Hmm.
looking at approving a fourth vaccine. So we've had the three vaccines, which are the Pfizer, the Pfizer, the BioNTech, the AstraZeneca, and the Oxford vaccine. Number two, number three was
The
the
Moderna one.
Moderna. And yes, now we have the you're an expert in this now. So now we have the
Novavax.
Novavax vaccine.
I like that.
And yes, so it's showing, I think the first article I saw was 86% efficacy, meaning that it's 86% effectiveness against the
Yeah,
COVID-19. But then now I've seen, as you've said, it's
it's
89.3.
89%. Yeah, yeah,
89.3%, and it also is, I think the important factor is that it's going to be effective against the UK variant. So
hmm,
was announced, and obviously they're still busy with the trials. They've conducted the phase 3 trials of the vaccine, so it's not yet deemed suitable, but they're hoping that the MHRA is going to pass regulations very soon for the fourth
Mm.
vaccine, the Novavax, yeah.
Right. Are the numbers dropping, do you think, in
Well,
the
I
UK?
was thinking about that, but then I saw quite a lot of news about different places where there's, in Cornwall and, a few other places where they're still seeing a lot of deaths in terms of the COVID-19. So I was thinking that, yes, maybe the numbers are coming down, but at the same
Mm.
time, we're still seeing deaths. So, I mean, we've had 28,680 positive cases in the last 24 hours. And
Mhm.
we have 1,239 deaths in the last
That's a that's
24
still a lot.
hours. Sorry?
That's still a lot. That's still a lot.
Exactly. So this is what I
A
was.
lot of deaths.
I had the
Yeah.
same thought in my head, but I knew you're gonna ask about it. But
Mm.
so for me, I can't really say that it's getting better. Maybe the number of positive cases are going down slightly, by half, but the number of deaths are still remaining quite significant. I mean, it's 1,239 in the last 24 hours in the UK, which obviously is a concern.
Yeah, one would assume that if the more positive cases we get, the higher the rate of deaths.
Yeah,
But it's not so this time around. It looks as
no,
if the number of positive cases have dropped, but
yeah,
there's been more deaths.
yes. Which is
And I wonder
why,
why.
exactly, why are we seeing still so many deaths? Whether it's because of the new variant that's more virulent, and because by now we would have thought that we know more about the virus, we know how to treat it, we know how to take
Mhm.
care of ourselves. So even if people are getting infected, that there shouldn't be so many deaths, but we are still seeing a high number of deaths, which is a concern. So there's still so many unanswered questions, Apoku, and I think that's why it's so important just to keep safe. The Prime Minister, Boris Johnson, addressed the nation on the 27th. And I did listen to it, and also I read it a few times, the articles. And I think he was saying that he's deeply sorry about that the number of people has taken us to surpass 100,000 deaths in the UK. So
Mhm.
we passed 100 million in terms of the infection in the world, and in terms of deaths in the UK, we've seen this week 100,000 deaths. So it is really a
Yeah.
concern. And he said that, um, and he offered condolences to everyone who's lost loved ones because of the pandemic. And I think he spoke a lot about the vaccine rollout. That 1.3 million have been immunized against the COVID-19, and they're hoping that at least 6.8 million people will be vaccinated. And I think the reason why that's important is because the timeline of when the review of the lockdown. So he's hoping that by mid-February that they'll have a better, clearer picture of whether or not we're going to come out of lockdown, and whether or not reopening of schools will occur. And I think they've given the date of 8th of March.
Yeah.
So that's all in keeping with the immunization schedule. So hoping that more people are going to get vaccinated, the numbers will go down, more people will have protection, and then they can look at opening schools. So the 8th of March is that a date that he's given. I think just in terms of when we can, so it's either mid-Feb, so by the 14th or 15th of February, and then the 8th of March about reopening schools. So it's obviously, and then he's spoken about the restrictions and the variants, and about restrictions of different countries coming into the UK and leaving the UK, and also quarantine in different hotels. So he's given a good comprehensive speech. And I think what caught my eye was about, there is a variant team, assessment team, that's already formed. So there's a
Mhm.
specific assessment team. Before we had the Sage and the Cobra. in the UK that was looking at everything about the COVID-19, how it's being managed, looking at the data and statistics. And now we've got a variant assessment team that's actually looking at specifically at the different variants and how to tackle it, which is significant, I would say, just to have a specific team for that.
Right. And in the news yesterday, he went to Scotland, didn't he, yesterday?
Yes.
The Prime Minister.
Yes.
And Nicola Sturgeon, the First Minister of Scotland, said it was not necessary for him to go. It wasn't essential for him to go to Scotland. And some people are criticizing him, saying he's not setting a good example, telling us not to move, but he's moving. What do you think?
Well, I think, if Nicola Sturgeon is questioning Boris Johnson as to why he actually went to Scotland, and yes, you're right, she's saying whether it was essential, it was not essential. So that's your guess is as good as mine in terms of this.
I can feel that you're trying to be really careful.
Yeah, about
as to how you're going to answer that question, and of course, rightly so. I mean, you can't. Sorry, I put you in that position. But
no, it is interesting because everyone's talking about it, and obviously, it's something people are wondering. We're in a pandemic. We're supposed to be traveling only essential. They've just put a ban on countries and quarantine for 10 days. So it is a bit of a question mark as to whether this was actually necessary. So yeah, so that is a concern.
Right. I was also reading. Let's come to our local community.
Yeah.
So I was reading something about Milton Keynes.
Yes.
And it looks as if it's not too good there in Milton Keynes. And you live in Milton Keynes.
Yes.
Have you got any news?
Yes. So I've been looking at the figures daily, and every day there's been concerns in terms of the number of cases, in terms of the number of deaths. So the figures that I read, they said that the figures were coming down. So, but they said, so today's news is that Milton Keynes is still stable. So COVID cases in Milton Keynes is still stable and deaths are going down. But so over the past 24 hours, so that was over the last 24 hours, 146 more people tested positive, and bringing the total in Milton Keynes alone to 17,215, and they had 3 more deaths recorded than 6 the previous day. So we are still seeing deaths, we're still seeing positive cases, and it is getting a concern because I've been reading every day about Milton Keynes, that there's a lot of cases, and also there are people dying in the hospital, but the numbers in terms of the deaths have come down.
Oh, okay.
Yeah.
Okay, that's
yeah,
right,
there's a concern with the number of cases, but in terms of the number of deaths, it is coming down.
Now, let's go to South Africa.
Yeah.
Because there's news in yesterday's news. You weren't here, but I would have loved to discuss it with you yesterday, as the news was breaking. That South Africa, they're going to get their first batch of vaccines
from India. Is it?
Yeah. They're going to start rolling it. Sorry, from India. Yeah, from India.
Yeah.
What? Have you got any news on that?
Yes. So the vaccines are going to be. So initially, when the vaccines are being supplied by the India, so India is going to provide. It already has left, and it's going to arrive in South Africa, and the vaccines will not be rolled out immediately. It will actually. It's going to be first, obviously, going through the process, and then they will roll it out. So, and so I think that's what I've heard about the vaccine that's coming from India to South Africa. And yes, I think they are obviously trying to, they secured, Africa has already, Africa in total has secured about 400 million doses of the vaccines. So they do need quite a lot, but
Right.
yeah, but obviously South Africa in itself is going to be looking at its own um, in its own sort of regulations in terms of the rollout of the vaccine. So there are vaccines on the way, and I know that it is something. So they haven't rolled it out yet. So they say that more than a third
Okay.
of the COVID-19 cases in South Africa and numbers have been surging with a new variant. So there is a concern, but they said the vaccination program is going to start. So far, they've secured 20 million doses of the vaccine, which is going to be distributed. So the first batch is going to arrive on the 1st of February. So in 2 days' time, it will arrive in South
That's in
Africa,
2 days.
and then it will start being
Yeah.
rolled out in 10 to 14 days. So they are going to review the vaccine before it's rolled out. So it will not be rolled out immediately. So once it arrives, it will be reviewed by the medical teams, and then it will be rolled out. South Africa is also expected to acquire doses about of the COVAX, another vaccine that we were talking about. So there's a COVAX one as well.
COVAX, where's that from? Is that the
So
China? It's the China one.
it might be. I'm not 100% sure, but that is another vaccine. So yeah. So as we know, so South Africa, definitely it's great news that they are getting the vaccine, but at the same time, there's obviously concerns that the vaccine is only going to be rolled out in mid-Feb, sorry. So by the in 10 sort of so the 10th or 11th of February. So mid-February, we will start to see the rollout of the vaccine. Um, so they are going to do a mass rollout. We know that. And I think the rollout will be probably similar to what other countries have done. So offering it all to the vulnerable age, so certain people over a certain age, like 70 and 80, then it will be looking at all the healthcare workers. So that's all we know about the vaccine. So it is interesting and it's great news for South Africa that obviously.
Well, it is great news, and it's interesting considering the fact that the South African variant of COVID-19 is actually really spreading in Africa.
Yeah.
It's yeah, because a lot of people travel.
Yes.
In Africa,
in South
from
Africa.
one country to the other, and
Yeah.
lots of African nationals travel into South Africa for business and out and all that,
Yeah.
So yeah, so it's great news. It's great news.
Yeah, I mean, I'm glad.
Right, okay.
I
So
actually
where
got
are we?
I actually got a friend that lived in the same we lived in the same area, and she's a nurse in South Africa, and she actually messaged me asking me what do I think about the vaccine. So I think people in South Africa are already now starting to ask the questions which obviously people in the UK were asking. So obviously people are going to get ready now to sort of take the vaccines, which obviously.
Well, it looks as if it seems as if a lot of people who were previously skeptical, they were thinking about and considering all these conspiracy theories about the vaccines and all that.
Yeah.
But a lot of people I've spoken to in the last few days,
yeah,
who were skeptical are now saying, you know what, I think I'm going to get the vaccine, and I would say that it's because education is going on,
yes,
and that includes what we do here
yes,
on HRB Breakfast, and even having those doctors come and talk to us about vaccines and vaccination, and debunking all them
yes,
myths and conspiracy theories. So yeah,
exactly.
So we're getting somewhere.
I think you're right. It's about awareness and understanding. Can I just say two things? Sorry. So just to say that with the vaccine, obviously the President Cyril Ramaphosa is working at its best and trying to get the vaccines for South Africa. And the Health Minister, Dr. Zweli Mkhize, said that yes, so on the 27th, they answered the questions around the medical aid and also the vaccine, and that they're going to be using a ID system for tracking and registration. So they are going to be using a system which is going to be able to track the person's information, whether they've had the doses of the vaccine, the safety, and whether they've had any side effects, and also details of the administration site. So there's going to be a online self-enrollment portal, and that's going to be obviously then it's an electronic vaccine data system. So they will get that, and people will be then be given a notification and SMS informing them. So once they've enrolled on the website, or they will be then getting a code, and with that code they would then be given the vaccine, and they would need to provide an ID. So each person is going to have an ID and a contact number for the site so that they can track and trace. So it seems like obviously that it's quite a sort of they obviously have it quite well planned out. So on Sunday, the 31st of the Sunday coming, the vaccines will leave India and will arrive on Monday the 1st. And then a further, so that was 1 million doses, and a further 500,000 vaccines will arrive later in the country. So SAFRA is another, can I just mention briefly, Popo, I know we're running out of time. So SAFRA is the South African Health Products Authority. So they are ensuring that there's no delay in the vaccine. So they're going to start targeting 1.2.5 million health workers. So in South Africa, that's how they're going to roll it out. They're going to target the health workers, then they will target at least 67% of the herd of the population. So obviously there's a lot of they said the vaccines are going to be free, and it funding will be given from medical aids. So private providers such as pharmacies will also be issuing it as well. So, but there's the electronic vaccine data system, the EVDS, which is obviously going to be the main sort of system that they're using. Just to say, with the SAFRA that I just spoke about, I mentioned a few like last week about the ivermectin, which is an anti medication against parasites, and it has been shown to be effective against um, the COVID-19 or coronavirus. So people have taken just a few doses of the ivermectin, and they have shown to be helpful against the infection, and a lot of people have recovered with ivermectin. So the SAFRA has now, the government has issued the go ahead of it, but there's still some restrictions in terms of it's only being used for compassionate use, and doctors, if they are prescribing it, they have to um, fill a certain form. So there's a regulator, so they are able to. So ivermectin and COVID-19 SA drug regulator allows controlled compassionate access. So that means they can get it, but it's obviously still regulated, and people will need to. The doctors will need to fill in. So if they're prescribing it, they will need to inform and grant Section 21 authorization with it, which is a Medications Act. So
all right.
yeah.
Yeah. Okay. Thanks for the information. Let's move away quickly, and but we haven't got too much time.
I know.
Do the numbers, and then we'll have to crack on. All right. So let's go to the Worldometer.
Yeah.
And check out what's it. I've just refreshed mine.
Yeah.
And so if you run us through it, please.
Yeah. So in terms of the Worldometer, we obviously I'm just going to refresh my page as well. So I've got the up-to-date numbers. So yes, we've reached over, so the numbers are going up rapidly. 102 million cases, 57,347 positive cases. So it has gone up a lot. In terms of the number of deaths all over the world, we are seeing 2 million 201,325 deaths. So that is the number of deaths globally. In terms of recovered, we are seeing 79 million. That's still a large. So 73,903,379. So that's still quite high, isn't it? In terms of
It is high,
totally, so total recovered. So in terms of the figures in the top 5 countries, we have USA 26,338,607 positive cases. In terms of number of deaths, it's 443,769 deaths. So that they're nearing 500,000, which is really a lot. India is 10,720,971 positive cases, and the number of deaths 154,047 deaths. Brazil number 3 with 9,060,786 positive cases with 221,676 deaths. Russia number 4 with 3,793,810 positive cases with 71,651 deaths. UK 3,793,000. So it's 3,743,734 positive cases, yes, with 103,126 deaths. So still quite high. South Africa number, very high. So actually the news said that UK is the most dangerous place to be in the world. So that's something we can talk about tomorrow. So that was one of the headlines I saw over the past few days, where they're saying UK is the most dangerous place to be in terms of the pandemic. But moving on, South Africa's number 15 on the Worldometer as of today, the 29th of January, with 1,437,798 positive cases with 43,105. So still a concern in South Africa and with the different variants, but hopefully with the vaccine rollout, things will get a lot better. And then Ghana, we are looking for Ghana, which is, it's gone to 89, which is 63,883 positive cases and 390 deaths. And as we spoke about UK, we've had 1,239 deaths in the last 24 hours, which is significant. And we've had 28,680 positive cases in the last 24 hours.
Right. Okay. Don't forget that we're supposed to be praying for the nation.
Yes.
Starting from Sunday.
Yes.
Every evening. I think it's around 6 o'clock. Say your prayers, Dr. Seshni, you and your family, for our nation. I'm going to do that with my family as well. Have a fantastic weekend, Dr. Seshni.
You as well. Thank God it's Friday.
I will speak to you sometime this weekend.
Yes, I will speak to you and see you. And yes, thank you so much. Have a blessed Friday, guys. Let's spread the love and not the virus. And stay safe wherever you are. Wear a mask, wear a face covering, use hand sanitizers, and maintain social distancing. And only travel unless absolutely necessary.
Okay. Thank you very much, Dr. Seshni.
Thanks everyone for joining at the Hospital Radio Bedford, and hope you managed to catch some of that information about the rollout of the vaccine in South Africa and the online system, the EVDS, which will be in effect. So have a look to the latest guidance about the vaccinations. The vaccines will arrive on the 1st of February in South Africa. It will be leaving India on the 31st. And hopefully the rollout will be within 10 to 14 days. from when the vaccines arrive. So, guys, stay safe until then. Do join me on the Happy Doctor's Kitchen with some happy and healthy cooking as well. Lots of love from my family to yours, and namaste. Bye, guys, and thank you for joining.